My name is Crystal Carpenter. I work alongside some amazing individuals at the Campaign for the Fair Sentencing of Youth, an organization focused solely on ending extreme sentencing of children across the nation. I'm here with Clint Smith, who recently defended his dissertation, so I guess I should reference you as Dr. Clint Smith. You've done amazing work highlighting disparities across the nation that exist specifically to Black and Brown people. We're here to talk today about structural racism and how it relates to the COVID-19 pandemic. I guess my question is today, based on what's been happening in the media most recently, Dr. Fauci, other leaders, governors from across the nation, coming out basically saying that the COVID-19 virus is disproportionately affecting African-American individuals. What policies and systems were in place that led us to this particular disproportionate outcome for Black Americans?
Yeah, no, I appreciate you asking that question because it's an important one. We find ourselves in a moment in which we're getting more and more data that reveals that Black people are being disproportionately impacted by this disease, by this virus. And I think without a sort of larger structural, historical, or social analysis, we can fall into the trap of thinking that Black people, the conditions that Black people have that are leading to these disproportionately poor outcomes are somehow the result of poor decisions, are somehow the result of laziness, or somehow the result of a lack of personal responsibility. But, you know, when the Surgeon General comes out and says, you know, Black people need to stop drinking alcohol and smoking tobacco and need to take better care of themselves, he is implying that it is somehow singularly our fault that we are experiencing these disproportionate outcomes, rather than considering the fact that the sort of social and historical realities that shape what so many of our communities look like are actually the things that are at fault. So what we see is that Black people account for 72% of COVID virus deaths in Chicago, 40% in Detroit, 70% in all of Louisiana, even though Black people are only 33% of Louisiana's population, and that's my home state, that's where I'm from. And these realities are shaped by a history of housing segregation. They are shaped by the reality of medical discrimination, in which Black women and Black men, Black women particularly, don't have their needs met by their physicians, in which they are denied care, in which Black people disproportionately have a lack of access to healthcare more generally. What we find is that unemployment disproportionately impacts Black people. What we find is that the conditions like diabetes and heart disease, those things are not simply a result of people eating too much fast food because they just want to eat fast food. It's a result of a sort of larger reality of food deserts. It's a larger reality of not having jobs that pay a high enough wage that people can go buy produce and vegetables and fruits and things that might be a little bit more expensive than the meal that you get from McDonald's, the meal you get from Popeyes, or the processed food you get from the store. And all this kind of creates this confluence of factors that make it so that there are conditions, there are health conditions that impact our community that are very much entangled in a history of racism, in a history of segregation, in a history of discrimination. And it's so important that we not forget that those realities are shaping what the contemporary landscape of inequality looks like. And it's deeply important that is at the forefront of this discussion, because otherwise we'll continue to just pathologize Black communities and make it seem, you know, as if the things that are happening to us are somehow our fault, and that people should feel bad for us, and at worst, you know, sort of deride us for the things that are happening to us, rather than saying, what has this country done over the course of decades and over the course of centuries to create the conditions in which this kind of thing is happening to these folks in the first place. And that doesn't even take into consideration the fact that the majority of Black people in this country have jobs that are now considered essential, right? They've always been essential, but aren't able to work from home. I think the statistics are...
I know they're staggering, I think, for a variety of reasons. It's a greater likelihood of working jobs that put people in the front line, right? And I think for me, when I hear, oftentimes you hear about doctors and nurses that's doing this amazing work in this space, right? They're on the front line, but also a lot of times neglected from that conversation are the grocery store workers, those that are cleaning in the hospitals, actually, making sure that the doctors and nurses are having those clean environments. And those are the jobs that you think, which I see more often than not, are held by a lot of Black and brown people.
Exactly. No, I think that's absolutely right. And I think we have, working from home is not something that everybody can do. Like some people who are very fortunate to be able to, work at home and have their Zoom calls. But a lot of folks, they got to go into these grocery stores, as you said. They got to go into clean the hospitals, as you said. They got to go to, collect our garbage. They got to go collect the recycling. They got to do all of these things that allow our society to continue to function. They got to deliver people's food. The list goes on and on. And as you said, Black and brown people are disproportionately the folks who are serving those positions, which means they also got to take public transportation to get to those places, and are continuously. So there's not only the sort of historical legacy that is shaping what the conditions in neighborhoods look like, it's the fact that historical legacy makes it so that people are working jobs that force them in this specific pandemic context to encounter and interface with people who might spread the disease to them in a way that so many other folks don't have to.
I think you brought up an interesting point, especially learning about your history, upbringing in Louisiana. When I heard the disproportionality or the disparate nature of how Black people were disproportionately affected by this COVID-19 virus, I started thinking about the term environmental racism that was coined in the 1980s, right? And when I heard about the rates in Michigan, for example, I thought about Flint and the water, crisis that they had there. And when I heard about the rate in Louisiana in particular, I remember learning about this 85-mile stretch of land that they called Cancer Valley, right? That was between Baton Rouge and New Orleans. And learning about that and learning about how the high rates of cancer deaths and things of that nature. So understanding when I hear these rates coming out, these high rates coming out of Louisiana and coming out of Michigan, those are the things I think about. And people forget that the structure was there to make these rates as high as they are now.
Yeah.
They weren't addressed.
No, I think that's definitely true. I think the reason you see such high rates of asthma in our community is tied to the legacy of environmental racism, for sure, right? You can look at all the social science that shows how landfills are more likely to be near Black communities, how toxic waste dumps and just the sort of chemical plants that send pollutants out into the air that create like profound air pollution, which is an issue we generally don't talk enough about. That is the air that so many poor people, and because of the nature of inequality and the entanglement of race and class in this country, the way that Black people are disproportionately impoverished in this country, we are being impacted by that air pollution. We are being impacted by those toxic waste dumps. We are being impacted by where people decide to burn their trash and all of these things. Like, these are not near affluent white communities. These are happening near poor Black and Latinx communities across the country.
I 100% agree. I think this moment, in a lot of ways, is exposing the structural weaknesses and disparities in the country, right? It's been decades of disinvestment and atrophy in this country, and I think a lot of that has been highlighted over the years. But at this moment now, I guess, how do you think we should change the conversation? I see a lot of the conversation being reactionary to what's happening now. But understanding that backdrop, that this is structural things in place, how do we change the conversation so now we start addressing some of these structural things?
One of the things that I think this crisis has revealed is that we have the political capacity to do a lot of things to make people's lives better that we could just do generally. Like, we don't have to wait for a pandemic. Like, you don't have to wait for a pandemic to not evict families from their homes. You don't have to wait for a pandemic to not cut people's water off. You don't have to wait for a pandemic to sort of magically find places for homeless people to live, right? Like, all of these things that society is doing, where, depending on the state, like, folks are letting out people, more and more people from jail who don't need to be there. Like, as I said, the evictions, as I said, the homelessness, and whether you cut off somebody's gas, somebody's water, somebody's electricity.
Emergency healthcare. Emergency healthcare.
Emergency healthcare. Even, how do we, after this moment, justify saying like, oh, you don't need to pay for your testing and treatment for COVID, like we'll cover that. But then after this, go and tell people that they do need to pay for it for cancer, right? Like it doesn't. There's a logical fallacy that sort of exists, and there's something that's, as you said, being exposed about the sort of inconsistencies of the American project, in which we are legitimating the way that we treat people during certain times, and then when there's an ostensible crisis, we say, oh well, we can intervene and actually make it so that you are not going to experience such profound, as much of a crisis as you would otherwise. But millions of Americans live in the midst of a crisis every single day, right? And I think that part of what we have learned is that, and part of what I'm hopeful as we come out of this, whenever we come out of this, is that this exposure to the myriad of holes that exist in this country, and in the sort of social safety net and social infrastructure of this country, is that we will be able to say, actually, these are things that the things that we were doing to mitigate people's pain in this moment are things that we should be doing for millions of people all the time, more generally. And I think this ties into the work that you all do with the Campaign for the Fair Sentencing of Youth. I spent so much time over the last few years working on this dissertation, and spending time with folks who were sentenced to juvenile life without parole, and like almost every single person that I spoke to grew up in conditions that were saturated with poverty, grew up in conditions that were saturated with violence, grew up in conditions that were saturated with joblessness and a sort of lack of hope for upward mobility in the formal, job marketplace and job ecosystem. And if you create conditions in which their lives aren't filled with such trauma and desperation, you significantly cut off the number of folks who are going to find themselves on a trajectory of entanglement in the criminal legal system. And I think that these are all things that we have to really think about, is like, what are the structural and historical realities that are shaping the trajectory of these young people's lives into this system, and how can we create the systems beforehand to make it so that they're not finding themselves locked up when they're 15, 16, 17 years old in the first place.
And to further that point, just thinking about the fact that Michigan and Louisiana has recently been highlighted, and further in our work, we've recognized that those are two states that have some of the highest numbers of juvenile lifers incarcerated. So just understanding that, to your point, that all of the underlying conditions exist prior to this pandemic, that kind of led people down, into this lifestyle in many ways.
Absolutely.
So yeah, I definitely 200% agree with that. I wanted to take a moment and talk a little bit more about your specific experience with your students and classes in Massachusetts prisons. You've done a lot of work in prisons. So speaking about some of the things you've learned in those interactions, and are there any people that stand out to you at the moment that might be at risk, or people you're thinking of and want to mention?
Yeah, so I spent several years teaching in the Massachusetts Department of Corrections at different prisons there. And then since we moved to the DC area, I teach with Free Minds Book Club in DC jail. And so, I've been working with folks who are serving life sentences. More recently, we've been working with young people who are serving, who are either about to be sentenced and go to the federal prison system, or who are on their way coming home, or who are waiting for a court date. The myriad of circumstances that exist in jail. Part of what I always tell people is that the students that I work with in incarcerated settings are often some of the most engaged, most thoughtful, most curious students that I work with. And I've taught in high school, taught undergraduate, taught graduate levels, and I think my entire dissertation was on the educational experiences of people who were sentenced to juvenile life without parole, and asking, what does education mean to you when you are told that you are ostensibly going to spend the rest of your life in a cell, when you're going to spend the rest of your life in a cage? How does 95% of people who are incarcerated ultimately are released, but we have these sort of 200,000 people who are serving life sentences or de facto life sentences. And what does education mean to them? Like, what motivates you to learn? And part of what I found is that education is this thing that gives people both a sense of agency, and a sense of control over their own lives. It gives people a sense of community, to be in conversation, to be in community, exchanging ideas, exchanging questions with people. And it gives people a sense of hope, right? Like, part of what is true is that, a lot of these folks have a really sophisticated sense of what I call the malleability of the law. And this idea that, like, what is the law right now might not necessarily be the law 5, 10, 15, 20, 40 years from now. And I think we see that with Miller v. Alabama. We see that with Montgomery v. Louisiana. Like, these were people who were told you are going to spend the rest of your life in prison. And then, 20, 30, 40, 50 years later, depending on the case, they're told that they have the chance to come home, depending on, what a judge says or a parole board says. And I think that folks in prison are acutely aware of that. And I think it shapes the way that they, in my experience, often approach education and the possibilities of what education has to offer. And I think that what is important for us as people involved in policy is to ensure that we are providing educational opportunities for as many people as possible, whether they're serving a life sentence, whether they're serving a 1-week sentence. It just doesn't matter, right? Because education is the thing that people hold on to say, like, I have a chance of one day coming home. And that changes their entire way of navigating and operating the prison, that ultimately makes it a safer, prisons are terrible places, but to the extent that it can be a safer, healthier place for the folks who are in there.
I completely agree. I always say that people operate with a glimmer of hope operates differently, right? Mm-hmm. So going into prison and you're 15, 16, 17 years old and you're told you're going to die in prison, mm-hmm. you have a period of hopelessness attached to your immaturity, right? It's coupled with it in many ways that, you don't feel like the need to educate yourself. Mm-hmm. Many of the individuals that I've encountered have persevered in a face of hopelessness, mm-hmm. but understanding that it has to be a level of understanding for those that operated under the guidance of having no hope as well, right? So for years, some individuals took 10, 20 years to say, let me start educating myself, just because it kind of works simultaneously with their level of maturity. So as they aged, they kind of got mature and said, okay, now is the time. But I think what I see most is those that had lighter sentences or was given an opportunity for release or knew they had that potential, mm-hmm. they take further steps at an earlier stage, mm-hmm. because they don't have this period of hopelessness they attach to them. They start off their sentence with hope, knowing that one day they'll come home. So they work towards their goals quicker. So I think what you said is absolutely point on. You had an interesting tweet, and you said specifically, and I'm gonna read it again, any articles, people, or politicians talking about Black people being disproportionately impacted by this virus without talking about housing segregation, environmental racism, food insecurity, lack of medical access, or medical discrimination is being irresponsible, period. We touched on a few of these points earlier in the conversation about the disparities that exist. Are there any particular ways in which you think people should act today in order to effectively create the changes we need in the future?
Yeah, no, I think that's a really important thing. And, we talked a little bit about this before, but there's a writer, a Princeton scholar, Keeanga-Yamahtta Taylor, who wrote a great piece in the New Yorker. And in it, she has a piece where she talks about how Black women constitute about 44% of all those who are evicted from their homes in urban areas. As a result, they disproportionately experience homelessness and depression, and in extreme cases, commit suicide. And the reality is that good healthcare, as we've talked about, means higher paying jobs that allow Black women and their families to worry less about their monthly bills, the cost of childcare, education. And Black women in Louisiana, the state where I'm from, face a higher rate of mortality from COVID-19. They face the highest rate of mortality from COVID-19, and they make 47 cents to every dollar made by white men. And I say that because it is in the group who is experiencing the highest rate of mortality at the hands of this disease makes less than half of what white men do, like beyond the context of the disease. And so it is fundamentally impossible to look at the people who are dying in Louisiana, in Michigan, in New York, across the country. And it is impossible to think about that and analyze that and understand why that is happening without also looking at those structural realities, without also looking at like the fact that these folks make less than half they make less than half in terms of their wages, already live in hyper segregated communities, already live more proximate to different iterations of environmental racism, as we've talked about before. And so that these things have to be held together. And the conversation cannot include one thing without also including the other. Because if you just say Black women in Louisiana have a history of COVID, then you leave it to people to think that something is wrong with Black women, or that Black women have done something to, or there's some level of personal irresponsibility that is reflected in Black women that makes that the case. But if you say Black women make 47 cents for every dollar that white men makes, then the nature of the conversation immediately shifts, and the onus is not singularly on the people for what is happening to them, but rather the system that has allowed these things to happen.
Well said. All right, Clint, we spoke a lot about, a lot of the disparities and issues that exist amongst Black people. With all that being said, with everything that's happening in the prison system, the injustices, the environmental racism, what gives you hope at this moment?
I think part of what we talked about before, I think there is a greater recognition of the ways in which structural realities are shaping these communities. I think that the conversation around systemic and structural inequality is in a fundamentally different place than it was maybe a decade ago. We're in a pre-Black Lives Matter era in which these were brought to the forefront. And I think that this moment provides us with an opportunity. Even when I don't watch a lot of cable news, but when I turn on CNN or MSNBC or any of these things, and I see more people, talking about structural racism in ways that I wouldn't have seen several years ago. And I think that I'm hopeful that means a larger group of people are able to then bring that analysis or part of that analysis into their daily lives. And so that when you drive around DC and you see that one part of DC looks one way and another part of DC looks another way, you don't attribute that to the people in those communities. Instead, you attribute it to things that were done to those communities generation after generation after generation. So that's my hope. We'll see.
Thank you so much, Clint. This has been an amazing experience. I appreciate your insight. Congratulations again on recently defending your dissertation and being Dr. Clint Smith at the moment. I hope I am the first interview that you've done as Dr. Clint Smith, but knowing your busy schedule, I'm sure that you've had a few others before me, probably. But it's been a great conversation.
Thank you so much. This was a great conversation. I appreciate all the work that you all do. It was incredibly helpful for me in my own dissertation, and more importantly, it's so helpful and so important to the sort of broader conversation about why we put children in prison and tell them that they might spend the rest of their lives there. And your organization has done as much work as anybody to push that conversation and make this country face it in a way that they need to.